Hello, pet parents, and welcome to another episode of Natural Pets TV. I'm Robert Semro, and I am joined by Heidi Nevela, Dr. Jodie, and Dr. Patrick. Thank you all for joining us. Dr. Jodie, I want to talk about natural and alternative pathways that we have and we see really an explosion of, and probably more importantly, a much better understanding and usage of.
This is a fabulous topic. We all love to talk about this. We live and breathe this every day with what we do. And I think what we would like to see is the natural modalities or the oral remedies being selected as a first line of defense rather than the last resort in many cases. But the caution, of course, with that would be make sure that you don't delay important veterinary care. We like to emphasize that we need a good Western medical diagnosis a lot of times to provide proper care. And when you're trying to choose some of these oral supplements, it can be difficult to choose safe and effective supplements. There is an organization out there called the National Animal Supplement Council. It's fairly newly developed, but now we can start to look for their little seal on some of the products. It's just one of many ways to start selecting safe products and get an idea of which to choose and how to dose them and those kinds of things. But then there's also a lot of physical modalities that we can use too, and even conventional veterinarians are starting to incorporate some of those into their practices.
Oh, yeah, absolutely. I've been in practice now for 17 years, and I didn't know coming out of practice that coming out of school, that acupuncture could be part of practice. And along with acupuncture, which is just inserting needles or substances into the body to stimulate acupuncture points, which are where nerves and blood vessels and lymphatic vessels all come together and converge and can create a whole body effect, releasing anti-inflammatory hormones and other substances that relieve pain. So I had no idea that that was even like an option that I could give my patients when I first started in practice in 1999. And now that's a huge part of what I do on a day-to-day basis, and actually take like every single patient and not just think, oh, could they have surgery? Could they have medication? But we want to think about what could we do from a food perspective? What could we do from a supplement nutraceutical perspective? What could we do from hands-on work and complementary and alternative type treatments, acupuncture, physical therapy, laser treatment, chiropractic, etc. There's so many things, but there also are so many things that it's hard to know what is the right thing or the right combination of things. So that's why pet owners really need to get that initial diagnosis as to, like, this is the anterior cruciate ligament tear. Should we have surgery? Should we not have surgery? If we're not having surgery, maybe we're going down that route of going to physical therapy. After we have surgery, maybe we're going to physical therapy. So it's so much more accepted, but it's good to work with a veterinarian that's open-minded to it and is going to be able to guide you down that right pathway.
Mm-hmm. And the natural modalities are very synergistic. They all work together. You can't choose an herbal as equivalent to a drug, but in order to avoid some of the drugs for pain management that can have strong side effects, you need to incorporate some chiropractic adjustment and some acupuncture and some herbals in order to get that same effect that you might get from a strong non-steroidal anti-inflammatory drug.
And there are in the herbal traditional medical system that I work in, there are herbal equivalents to the pathways you're talking about. We, of course, always have people coming first with a diagnosis from a qualified vet, but if they're looking for natural alternatives, there are, I mean, the ones that I work with are Andean, Amazonian, and from the Humboldt Current, so the selections are amazing, and they've been around for 2,000 years, so they're well developed. However, you still, when a pet parent contacts us, we say, well, these are novel plant steroids, or they take the form of natural corticoid steroids, basically, and they can be adjunctive. So we're never saying use these instead, but a lot of them can safely be integrated with synthetic interventions. So
what are some names of some of the popular herbals that you use for pain management?
Oh, well, there's many, and it also depends on the type of pain. It's really so well developed that is it nerve pain? Is it muscle pain, or whatever? But so there's some that are just central nervous system relaxants, but they also affect the heart and blood pressure rate and the smooth muscle relaxation. So something in that sense could be like a valerian root or a passion flower. There are much more like malungu that are much more specialized and work on pain-mediated responses. But then there's also things like achiote and sangre de grado that are natural plant-based steroids that have a whole other array of first and primary and secondary chemical constituents to it. So it just, it's for people to know that there are other alternatives that they can safely combine. Like sangre de grado has absolutely no contraindications, drug interactions, or cautions. So that's a really good one that you can put into, like if you have nerve pain, it's a neurasthenic, you can put into a regimen safely with any other medication. And so it's just a good, and it doesn't really have a downside on the body.
And from those plants, of course, comes essential oils, which is a whole nother modality.
Exactly. Yes.
I really enjoy combining essential oils with my acupuncture practice. Copaiba is one of my favorites.
Wonderful.
It's actually a sap from a tree in the Amazon.
Right.
Contains beta-caryophyllene, which is a potent anti-inflammatory natural chemical constituent. Wintergreen, which is where salicylic acid comes from, which is how aspirin was developed. A lot of the drugs out there were developed from plants, but the plants had it right because they're more balancing and most of the time much safer, and a lot of things plant-wise can be used long-term safely, where we start seeing trouble with that, with the medications. Steroids, of course, are a good example where we have to be careful how long we use them.
Right.
I've always been a fan of trying to reduce the reliance on medications that potentially have side effects. A lot of pet owners need to be aware that a single or multiple doses or long-term doses or misuse of drugs can really cause life-threatening side effects. Like anti-inflammatory drugs, non-steroidal anti-inflammatories are very effective at reducing arthritis pain, but some pets respond negatively to them and have digestive tract upset, kidney, liver issues, sometimes even blood clotting problems. So we want to make sure the patient it's appropriate for their use, but then try to reduce the need by having lifestyle changes, which include changing your home environment so there's more traction for your pet to walk on, or not that really high bed that your pet has to jump up and down off of, or even gating stairs so they don't tumble up and down. Weight loss is really important in weight management because so many pets carry extra pounds. That puts stress on all body parts, including the joints, and worsens inflammation in the body. And then there are ways that you can naturally reduce inflammation on a day-to-day basis. Like I'm a huge fan of fish oil-based omega fatty acids. A lot of my patients and I take that myself. Or like I think probably the herb that I'm most familiar with for anti-inflammatory effect is boswellia. And turmeric, or curcumin, which is in turmeric. And so those are really those, I take them myself as well. I'm like the biggest guinea pig for my patients. I'm going to try it first, and if it works for me, then hopefully it'll help you too. So I'm a big fan of taking the drugs, but trying to reduce the reliance on them. Like the dog falls, it hurts itself, it breaks its leg, it has surgery, you need your drugs right at that time, but you can pretty quickly try to transition the patient off of the drugs or onto less drugs with our supplements and our other complementary and alternative modalities.
And another great Chinese herbal is cordalis that has analgesic and anti-inflammatory properties. And we have to remember, if we are using one of those NSAIDs long term, that can also be actually damaging the cartilage as time goes on. So combining that with the glucosamine type products, the hyaluronic acid, to help rebuild that joint at the same time as we're fighting that inflammation to make them feel better quickly.
Absolutely, yeah. Make the body healthier so that less medication is needed. And along the lines of oral nutraceuticals, which are food-derived substances having medicinal benefits, there are medications that work like nutraceuticals. I use polysulfated glycosaminoglycan, which is commonly known by a brand name, which maybe I can or can't say on the show, not quite sure. But it's an injectable product that is sterile, clear liquid that's very simple to inject into the muscle of dogs or under the skin in cats. I teach owners how to do it all the time. I incorporate that into my treatments. I give it as an acupuncture treatment, so I inject that into acupuncture points. And that directly goes from where the injection site into the blood, into the joint in 2 hours. And it has been proven to help to rebuild cartilage as compared to supplements, which may not work quite as effectively and need to be taken every single day for long term in order to work.
And a whole other modality to mention is homeopathy.
Oh, yes.
And as acupuncturists, and I believe you went to IVIS.
Yes, I did.
And I went to the Chi Institute, graduated in 2008. And you can also inject homeopathic remedies. don't know if we can mention those or not either.
Brand names.
But there is a great company out there that we use for humans, but we also use them in the animals. So homeopathy is an energy medicine, but a whole nother great modality that a lot of us try to incorporate into our holistic practices.
I think it's just important to say too that just because it's natural doesn't mean it's safe long term.
Yes.
And some of them are meant strongly, like for instance, strongly antimicrobial products like Chunkapedra, which are good at addressing urinary inflammation and those kind of issues. Really should be used 30 days with pre and probiotics, digestive enzymes added for the benefit of gut flora, but cycled off for 7 to 10. So just not to have a misconception that because it's natural, it's safe. You know, some can be used nonstop and over the lifetime very well. But and then also just please, whoever you're working with, make sure you check for the contraindications, interactions, and cautions, because natural products do have them. They typically are far safer with less side effects than synthetics or other interventions, but still you need to be working with someone who knows what they're doing.
Even the simple Western herbals, I usually tell people to use for 5 days on, 2 days off. That also gives you the opportunity on those days off to kind of assess whether or not the product is working. Does it make any difference? How are they when they're on it, when they're not on it? I also try to choose Western herbal products that are glycerin extracts rather than the alcohol extracts for the animals. They're also more receptive to it. It's more palatable. Might be slightly less potent, but I think it's also safer long term.
Well, as you can see, there are a lot of options out there that we all have when dealing with our pet's health, but you've got to be working with an expert. And what that really means is you have to be communicating with them. So remember those pet journals. Remember to work with someone that you trust, that you can communicate with, and it's going to be better for you and for your pets. Thanks for joining us here on Natural Pets TV. Hey everybody, thanks for joining us. It was another great episode with a lot of great information, and we really appreciate you keep the conversation going in the comment section down below. And don't forget to subscribe to the channel, as we have a lot of great episodes with a lot of great information coming to you with a lot of great guests. And if you want more information on our guests, for Heidi Nevela, you can get that at naturapets.com, Dr. Jodie at drjodiesnaturalpets.com, and Dr. Patrick at patrickmahaney.com. Thanks for joining us, and we look forward to seeing you soon.